Hello everyone, my name is Brendan Kim, second year internal medicine resident at Kaiser Los Angeles. Thank you so much for the opportunity for allowing me to present our presentation, which is titled Predicting the Risk of 30-Day Readmissions for Patients with Heart Failure Using a Machine Learning Model. As a quick introduction, congestive heart failure, or CHF, is a widespread disease that affects nearly 5 million Americans today, with approximately 500,000 new cases each year. Today, heart failure is divided into heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. Both subtypes significantly cause hospitalizations due to heart failure, which happens to be the leading cause of 30-day readmissions in hospitals in the United States. Since 2012, the Hospital Readmission Reduction Program, also called the HRRP, imposed financial penalties for higher than expected 30-day readmissions for conditions such as heart failure, pneumonia, and myocardial infarctions. In total, hospitals have been fined approximately $2 billion in penalties by the HRRP from 2012 to 2019. In an effort to reduce the cost of penalties, hospitals are incentivized to reduce readmission rates, and many studies are aimed to better predict and prevent readmissions. The literature currently is full of studies that have shown that machine learning may have potential in improving treatment of heart failure, which is a leading cause of hospitalizations in the United States that happens to impose a massive human and economic cost as well. The purpose of this study was to develop a machine learning model that can reliably predict 30-day readmissions for heart failure. We conducted a retrospective cross-sectional chart review of 117 patients who were discharged from a tertiary hospital in the Sacramento metropolitan area with a diagnosis of heart failure between the time frame of April to October of 2018. The following patient data features were entered into the database: age, gender, troponin, BNP, left ventricular ejection fraction, BMI, creatinine, GFR, hemoglobin A1C, and presence of comorbidities such as prior stroke, peripheral vascular disease, sleep apnea, atrial fibrillation, and coronary artery disease. The computer model was created using XGBoost, an open source machine learning library with an ensemble decision trees feature. The neural network was built using the Jupyter Lab environment with Python programming language. The data from 100 patients were randomly split up into the training data and validation data on the 3 to 7 basis. Overall, data from 30 patients were randomly chosen by the computer to test the validity of the model, while data from 80 patients were used to train the computer to create a model to predict 30-day readmissions. The additional data from the 17 remaining patients were used by the computer to further validate the model. Our results were reassuring and surprising as well. Out of the 117 cases studied, a total of 42 cases were readmitted, which equated to 35.8% readmission, and 80 cases were randomly selected to train the model. The validity of the model was tested using 47 randomly selected cases. Of these 47 cases, our model correctly identified 31 out of 39 cases that were not readmitted and 3 out of 8 cases that were readmitted, yielding a negative predictive value of 0.86 and a positive predictive value of 0.27 respectively. In conclusion, our machine learning model has a high negative predictive value for readmissions and performed well at predicting which patients were not readmitted for heart failure after 30 days. This model could be used to identify low-risk patients for a readmission and thus enable care teams to direct resources and interventions to patients who are at high risk for intervention. Thank you so much for your time and listening. We hope you enjoyed our presentation.